Hello everyone, welcome to Teddy Learns 100. So today we'll be talking about spontaneous abortions, and the source that I'm going to be using is Amboss. If you do not have Amboss, you can always make a free or you can always take a free account and get the 7-day trial. I think it's a really good resource. So let's begin. So what exactly is spontaneous abortion? So if you know that pregnancy is kind of like a 40-week game, right? Very difficult game. So this is 20 weeks. So if the loss of pregnancy occurs within this time period, then we call it the spontaneous abortion, right? Now, what can be the causes of spontaneous abortion, right? I always like to think of causes in OBS, especially mom and fetus and placenta, right? These are the three main themes that kind of revolve, right? So causes may there can be mom causes, there can be placenta causes, and then there can be fetal causes, right? So in the maternal causes, there can be, let's say, the uterus, is maybe problematic, how maybe there are septations, right? There can be leiomyomas, right? There can be fibroids, that is. There can be adhesions, maybe because of pelvic inflammatory disease or something. There might be problems within the cervix, right? There might be cervical incompetence, right? There can also be systemic diseases, like diabetes and hyper tension, hyperthyroidism, right? Or hyper or hypothyroidism. There can be, hypercoagulabilities, like your anti phospholipid syndromes, right? There can be infections, there can be genetic disorders, and there can be so many of them, right? But what is important to remember is that anti-phospholipid syndrome is basically related with recurrent pregnancy losses, right? Recurrent is pregnancy losses is when you have more than two losses of pregnancy, right? That is before 20 weeks of gestation. Now, if we talk about the fetal-placental problems, right? So they account for up to half of all the pregnancy-related losses, right? Now, what can it be? Like, because of congenital abnormalities, there can also be, something called an embryonic pregnancy. In this, there can be congenital abnormalities, and then there is something called an embryonic, right? As the name is suggesting that there is only the formation of gestational sac without an embryo. Okay, so now moving on to other causes, right? So you know that when the lady is pregnant, imagine that she falls down the staircase, and that's trauma that might lead to spontaneous abortion. There might be, certain a condition, so where you need to rule out some genetic diseases, right? So you need to perform like amniocentesis or chorionic villus sampling. That also might be a cause of spontaneous abortions. There might be, imagine a woman living in near a factory where toxins are exposed, right? Or maybe she smokes, right? So environmental causes can also lead to abortion. Now it's important to understand, if you can open up a Google image of spontaneous pregnancy losses or miscarriage types, so you will see around five, types of miscarriage. So number one is threatened abortion. So in whatever abortion you're talking about, right, think of these things. Is there any bleeding? I mean, vaginal bleeding. Is there any fetal activity present? And are there products of conception? Where are they? What about the cervical os, right? And then what is the prognosis? So, so if we talk about the threatened abortion, right? Threatened means that there is a threat, right? So how do you know there's a threat? A mom comes to you and she says, doctor, I'm having some bleeding and I'm pregnant and I'm so worried. What should I do? So you say, okay, let's do a fetal to check the fetal activity, let's do an ultrasound and to see, right? So there is fetal activity present, right? And then you see that, all right, the product of conception, that is the pregnancy, it's still intrauterine, right? And the os is closed, right? So imagine that there is this uterus, right? And this is the cervix, and this is the baby over here. So right now your os is closed, and this is the baby growing there. There's only a little bit of blood coming, so the mom is like thinking, oh my god, there is some threat to my baby, what's happening to my baby? The prognosis is reversible, right? That you might do some interventions to reverse the situation. Now there is something known as inevitable. If inevitable means that no matter what, this is bound to happen. So in that, there's bleeding. Yes, there's bleeding. Fetal activity, there might be, there may not be. What about the product of conception? Teddy, what's happening? So there might be visible or it might not be visible, right? What about the cervical os, Teddy? Well, it's going to be dilated. Oh, so that means, Teddy, that this is so little. What about if this gets big? Then this might just drop out. Yes, that's right. This can happen. Teddy, is there any hope? Unfortunately, it's going to be irreversible. It is bound to happen. The pregnancy is going to be lost. All right. Then there is something known as this is threatened. First there's threatened, then comes inevitable, okay, then comes incomplete abortion, right? Incomplete is that vaginal bleeding, yes. Fetal activity, no. The baby is unfortunately not with us anymore. The product of conception is within cervical canal or uterus, right? So some goes out and some is still there, and obviously your os is going to be open. It's irreversible, of course. Then comes complete, right? That complete means that, is there vaginal bleeding? Yes, there might be. Is fetal activity? Of course, no. The baby is not with us anymore. So the product of conception is completely, therefore we are calling it completely outside of uterus, right? So, and the cervix, after expelling everything, is now happy and it's now closed. And obviously it's irreversible, right? Now there's another category which I want you all to know. That is, let's choose purple color for some reason. It's called missed abortion. You miss it, right? Is there bleeding? No. So does the mom get any threat, or is the mom any alarmed? No. So fetal activity, no. The baby has just peacefully passed. Is there any product expulsion? No expulsion of product, okay? And cervical os is closed, therefore there is no expulsion, and it's of course irreversible. Okay, so I hope that this table is clear to you, and I would highly recommend that you go over it again because it's very, very high yield. Okay, now a woman comes to you with, let's say, any abortion. What is the, how do we diagnose it, right? Let's choose green for diagnosis. So Doppler ultrasound, right, is used for checking the activity of fetal heartbeat, right? So Doppler is the ultrasound that is used, so to see the activity of the heart. Absence of fetal activity of the heart should raise suspicion for spontaneous abortion, right? Heart present, no present. Activity present, no activity. Not activity present, so spontaneous abortion chances, kind of, you are alert now. Okay, so now, then after that, this is the first thing that you will do. Then what you'll do is you will do pelvic examination, right? Pelvic examination, you will be doing that. In cases of suspected spontaneous abortion, visualization of cervix is necessary to confirm that the source of bleeding is uterine, right? So in cases that when there is vaginal bleeding, you would want to do pelvic examination, right? And then comes transvaginal ultrasound. Okay, now when do we do that? It's done, best imaging, after once there is absence of fetal cardiac activity, right? Or confirmed uterine bleeding, okay? And now we did this as well. Now, how will we know that, okay, a spontaneous abortion has occurred, right? There will be fetal cardiac motions absence. There will be abnormalities of the yolk sac or gestational sac. There will be downtrending beta HCG, right? So, what are the findings consistent with spontaneous abortion? Findings consistent with spontaneous abortion: its absence of fetal cardiac motion, abnormalities of the yolk sac, and decreasing beta HCG. All right. Now comes the main thing. Let's choose let's choose like blue for this, okay? Or no, blue has been done. We'll choose dark green for it. Treatment bed, right? So there is prevention, right? That minimize with risk with treatment of maternal disease and adequate prenatal care. So prevention is always better than cure. You don't want to have these abortions, right? Because getting pregnant and the entire process is so precious and sacred. You don't want to lose the baby. So prevention, if for example, as we discussed the etiologies, right? So there can be mom causes and then fetal causes and all that. So if there are mom causes, so just prevent it, right? That stop smoking. If there are any disease like uncontrolled diabetes mellitus, so just prevent it, right? Get it solved and then get pregnant, mom. And then there can be prenatal care that you can provide, right? So if we talk about threatened abortion, right? So, what is threatened abortion now? If we talk about threatened abortion, we talked about that, okay, so is there bleeding? Yes, there's bleeding. That alarmed the mom. She came to the hospital. Fetal activity, we tried to check it. So, yeah, there is fetal activity present. We saw then in the ultrasound that are there product of conception in the intrauterine place? Yes, they are in the uterus. Is the os closed? Yes, it is closed. Okay, can we do something? Yes, it's reversible. Let's get to work. Let's manage it. So what do we do is that expectant management, right? We try to do expectant management. When we are trying to do expectant management, there will be two fates. Either that it resolves, right, and then you go back on normal pregnancy, right, normal pregnancy journey, or you kind of end up into inevitable, or incomplete, or complete abortion, right? Or complete abortion, right? So either you do this expectant management, you would advise the patient avoid strenuous physical activity, exercises. You get like weekly pelvic ultrasound, right? And then we also would want to get the RD negative women should receive, and then also an important thing that RHD negative women, right, they should receive RHD immunoglobulin, IgG, TKRD, IgGs, right? Because otherwise, for example, if the baby is positive and the mom is negative, the antibodies of mom will be working against these things. Now, if we talk about the inevitable, incomplete, or missed abortion, right? So, what can be done on that